Hello, Dr. Mangala. How are you doing?
I'm fine. I'm fine. How
Good,
are
good,
you?
good, good. I'm fine. I'm fine. So, where are you right now?
I'm in Sri Lanka at the moment. I'm practicing, but I'm looking forward to join my family in Canada because I have missed them for 2 years almost. So now,
Oh,
since I have been selected to SIPA, I'm looking forward to come to Saskatchewan and start my practice.
so
So I
when you
can be
say
with my family again.
SIPA, what do you mean? What is SIPA?
SIPA means Saskatchewan International Physician Practice Assessment.
Okay.
So, which I got selected.
Mm-hmm.
So Dr. Brony, you helped me a lot in NAC exam as well as the TDM, which are
Okay.
essential prerequisites to get through to the SIPA.
Okay. So you were in Sri Lanka preparing for the exam, and then you came
Uh,
to the Nakoski or what?
the thing is, during the NACOSKI time, I was in Canada because
Okay.
NACOSKI, I cannot do it remotely, so it'll have to be in person.
Okay.
So I came there and did the exam. It was
Mm-hmm.
during a difficult time.
Mm-hmm.
Then only you helped me actually in those mock exams. You guided me through, so
Mm-hmm.
I could actually sail through the exam very well and get a good score.
Okay, good. And then after that, you did a TDM course with us as well?
Yes, after that, actually, I really actually got involved with your team during the TDM course because during the TDM, I was working in Sri Lanka because I have a busy practice here as well.
Mm-hmm.
So, the thing is, didn't have any clue about the TDM exam.
Okay.
So, since I subscribed to your course and followed all your lectures and made my own notes
Mm-hmm.
by myself, and of course, recollecting them, listening again and again, reinforcing the facts in the lectures,
Mm.
actually, it helped me a lot actually to get through the exam. So I didn't have any problem of actually passing the TDM exam because I was very comfortable by the time actually I went for the exam because of your TDM course.
Okay.
Thank you for that.
Oh no, thank you very much. I'm very excited. So that means you were bold, you were determined to get through this, and that is awesome. So you stayed in Sri Lanka, prepared for the TDM, and then wrote it, and now you are going to move to Saskatchewan to do the Saskatchewan Practice Ready Assessment Program. Congratulations, I would like to say. So
Thank you.
so before you took the course and after you took the course, what was the difference in your perspective so far as these courses are concerned? Like, how did you see your confidence in preparing for the exam?
Uh, especially with the TDM. Now, since I subscribed to your course
Mm-hmm.
and went through your course materials,
Yeah.
I realized that the thing is I didn't have a clue of what will be asked in the exam.
Mm.
So one thing is your factual. The lineup of your facts,
Mm.
the line of your lectures, quite excellent.
Mm.
And everything was given in a very straightforward, simple form. That's one thing.
Beautiful.
The second thing is when I participated for you had couple of training sessions for us as well during the TDM. You highlighted the facts, which we should know as a GP, right?
Beautiful.
As a GP, you highlighted with your experience, knowledge, and as a mentor, you highlighted the facts, which is actually there in the course as well,
Mm.
so that actually we could actually concentrate on those areas
Mm.
and then be confident. So,
Beautiful.
with that in mind, I studied your course. Actually, I didn't study anything else. Actually, I didn't
Mm.
study I studied completely your 2EDM course.
Mm.
I made my notes out of that. So I have two books as well. I
Beautiful.
made my notes, two books, so that actually, uh, it's sometimes it's easy for me to make notes to recollect the thoughts.
Mm-hmm.
And then, of course, I had another discussion partner, which of course I found after subscribing to your course,
Okay.
right?
Okay.
And she's from Trinidad. She's from Trinidad.
Beautiful.
Uh, she's already in the SIPA program now because she got through SIPA actually a bit earlier than me because I had a problem of, here there was a documentation delay. Otherwise, I should have got selected to the earlier iteration. right? So
Okay.
there's a problem with the document, it's administrative delay. So because of that, I got selected. So anyway, because of that, I was able to discuss. I mean, we both were in the same course, your course, TDM course. So we were able to discuss the facts and further consolidate. So both of us actually got through very successfully. So actually, in a nutshell, your course is actually very, very comprehensive, up to detail, very meticulous, as well as I would like to say, it's up to the point. I mean, or you have actually remove all the clutter or unnecessary things. You know, as busy physicians, we don't have actually time to look into the small print, which of course not asked in the exam as well, which of course not asked in the exam. So it's a concentrated focus course. I would say a sure success course. So it's a good thing. Actually, I would like to say very confident. I mean, 100% confident by the time I went for the exam, because I was staying in another country, doing my practice, you know, having no clue about the exam and finally passing the TDM comfortably. I would say comfortably. I mean, because of this course only, actually it helped me to come to that level.
Sure. So how has it impacted you even after writing the exam in terms of your total outlook to practicing and common GP cases you are handling both in Sri Lanka and, you know, your total outlook to medicine? How has it helped you?
Actually, yeah, that's another thing. I mean, the thing is, okay, purpose of learning these things is, one purpose is to pass the exam. Other thing is actually give the patient the best care. I mean, that's the most important thing rather than passing the exam.
Yeah.
Right. So actually, your course actually all based on evidence-based facts. I mean, modern facts. So actually, certain things which I learned actually made me to change my practice. Suppose, for an example, certain drugs. Actually, I learned about some new drugs from you, which are actually, so then actually I started prescribing those new drugs after going to a course. And also certain protocols, management protocols, I changed myself for the betterment of the patient. So the patient, the feedback was also quite good. So actually changed the way I practice for the betterment of the patients as well. So actually it had what I would say is a positive impact on my practice. So ultimately the patient care.
Beautiful. This is awesome. You know, it's great to hear that it's not just something to prepare you for an exam, but something to change. It's a practice changing exam as well. So what is your advice to people who want to know more about our program? What is your advice?
Yeah, actually, what I advise is actually MedCognito is a very good, it's called for IMGs. It's a good gateway. I would say one of the best gateways in Canada. If you want to get through the exams, and of course, actually relate a success story like me at the end of the day.
Sure.
Right. So I think for the QE1, as well as because I have the QE1, also I have a good friend of mine who participated in your course. He has got a very good score in QE1.
Beautiful.
He told me.
Beautiful.
Right. So, but at that time, QE1, at that time I didn't know you. But anyway, for the NAC, I would say this is one of the best courses to say, and the TDM also. It's one of the best courses, because what I advise is, if they follow what you say correctly, and of course put their hard work and dedication onto that, definitely one will get a good score. And obviously, you know, good score will take you, definitely will get you an interview as well as a slot in Canada.
Beautiful. And in relation to the support we were providing, like beyond the medical knowledge, the emotional support, and the guidance about day-to-day things, how did it also go as well?
Well, the thing is, yeah, in addition to the subject matter, you provided actually a lot of details about the type of practice in Canada that we do, as well as, you know, kind of emotional encouragement. Actually, what I like is, you encourage the candidates very much actually to perform. That's another thing.
Beautiful.
Right? Because the thing is, I can remember the first time when I was presenting a case in the NAC, you encouraged me a lot, right? I thought that, I didn't perform very well on that day, but still you encouraged me. So actually that encouragement took me, actually gave me the motivation actually to actually perform better. So that took me a long way. So your encouragement and motivation is quite awesome. So, I mean, nobody else sometimes has will provide that, because if somebody is just very neutral and without just giving positive reinforcement, we tend to get discouraged and we tend to get puzzled whether we have performed better or not. So at the same time, with the encouragement, you are highlighting our deficiencies. You are giving the negative feedback in a very, very sensitive manner so that we can rectify ourselves. We could rectify ourselves and put our maximum output. That's one of the things. And the other thing is, you gave the details about your province, Saskatchewan, and the health system and other things to get an idea. So probably that also helped me a lot.
Beautiful, beautiful.
To be more comfortable in the probably working there now.
Sure.
To look forward.
Yeah. Dr. Mangala, frankly, I'll say welcome. And congratulations once again. It's been a long journey. But one thing I like about you is your consistency, your persistence, and the fact that you knew what you wanted and you went for it. And for me, it always gives me a lot of joy to see, candidates go through all the steps to get to the finish line. I wish you all the best in your practice. And I think we are friends forever now. We are now colleagues. So all the best as you start your practice, and all the best to all your friends who also want to get into practice. All the best to your family. And, come, let's make the healthcare of other people worthwhile and better. I'm very, very happy for you. And, the sky is not even enough. You can just go, and go. So all the best. And thank you very much. Bye-bye.
And thank you very much for your support and the guidance as well. So I will never be forgotten, and I will always have this MedCognito in mind for my success story, as part of my success story.
Beautiful. We are happy to be part of your story. Very happy. Okay, sure.
Thank you.
Okay, bye.